Louise Bradley is the President and CEO of the Mental Health Commission of Canada. She presented the Commission's vision and work to transform the current Canadian mental health system. Her own personal connection to this work drives her passion.
So, we have a small mandate. It is to transform the mental health system. I mean, go big or go home, right? What we can do is to leverage the work that you are already all doing. And so our biggest role is to try to bring all of that together and make the best use of the work that's happening across the country. We have the ability, the formal commission, to bring together everybody into the commission tent that allows us to do the work that we absolutely have to do. But what we do have a responsibility is to ensure that the work that has begun and that is ongoing stays that way. So we need to build and work with each of you to help us figure out a way to ensure that that work continues. So, Canada is the only G8 country that doesn't have a mental health strategy. And we released about a year and a half ago the framework document for the strategy. And that was the easy part. That was outlining what needed to be changed. We're now in the process where we're talking about the how. That's not so easy. So that's recognizing that in Canada, people are more likely to consult their family physician about mental health problems and illnesses than any other type of healthcare provider. The draft states that strengthening the mental health capacity of primary health care yields unbelievable benefits, including improved access, better use of resources, improved outcomes, and greater satisfaction with care. It says that the efforts to expand collaborative approaches to primary health care settings in Canada over the past 15 years has already made a difference, and it has. So the work that has been ongoing has made a difference. It has helped to promote a shift in attitudes towards collaboration to begin with, in providing training, in changing fee structures, which is a huge issue, and including mental health as a priority in primary health care settings. However, despite this progress, the draft strategy acknowledges that there's still plenty of room to advance the role of primary health care and develop stronger linkages with community-based services. The draft also states that this can be accomplished by better defining competencies, establishing protocols, and expanding access to more flexible fee structures. It also says that it's essential to build strong relationships amongst all the providers and foster ongoing communication. We also, as you will see throughout the entire document, is the whole concept of recovery. And I was absolutely thrilled as I visited my old alma mater, the Forensic Hospital here this week, to see that Nova Scotia is still on the leading edge of PSR and recovery principles. When you see it truly implemented in a setting such as that, you know that it has really taken root. And so that was an absolutely wonderful thing to see. The fact that people's lives of people living with serious mental health problems and illnesses can be shortened by as many as 25 years by chronic disease and suicide absolutely has to be addressed. So, one of the other tasks that Health Canada gave the Commission when it was announced was to address the issue of stigma. And let's face it, all roads lead to stigma. So we started off by targeting two groups, and we've since added two others. The first is children and youth, and we hear from people, we know that signs and symptoms of mental illness from adults say that they started when they were children and youth. And also, we're targeting youth to try to prevent the attitudes and behaviors from developing in the first place. The other one is the workforce. And so we've just started to evaluate stigma programs targeting in the workforce, and I'll talk about a little bit more work that we're doing about that in just a minute. But the third one is the media, and with all due respect to my colleagues who are journalists sitting in the audience here today, you do have a role to play as well. But the one that I want to talk about a little bit more about, because so many of you here today fall into this category, is healthcare providers. And I have to say, it always saddens me a great deal, and I'm somewhat embarrassed to say that we need to target healthcare professionals, because I'm one. And yet I know, as has been pointed out to me by consumers in this province, I have to say, that I was greatly humbled when I learned that some of my own behaviors were quite paternalistic, and that I needed to change some of my own practices and behaviors. It was a very painful lesson for me to learn. But in doing so, I recognize the problem that is being faced, and that it's something that I think we all need to look at. And so one of the areas that we're looking at is taking place in the Central LHIN, the local health integrated network in Ontario. And Opening Minds is looking at this because they're offering a 3-hour course combining traditional teaching, a video, and featuring people with lived experience, because we're learning through Opening Minds that direct exposure and contact with people with lived experience has the greatest impact. And we did pre- and post-testing on these sessions, and the preliminary results are showing that the program is actually making a difference and having a positive impact on changing attitudes and behaviors. The third area that I want to mention is the workforce, which I referenced a little bit earlier. It's estimated that 10 to 25% of workplaces are characterized by conditions and environments that are considered mentally injurious. So in other words, the very thing that we spend most of our lives doing can actually cause mental health problems and issues. So last week I was extremely proud to be part of an announcement in Ottawa along with other government departments and with the Canadian Standards Association and BNQ, that we are part of a project that is going to develop psychological safety standards for the workplace. And so in the same way that we have physical standards, I mean, we don't see anybody anymore working in areas that require hard hats and steel-toed boots. We wouldn't dream of putting people in there without those safety standards, yet the psychological part of it has not been considered. So we're thrilled. Canada is the first in the world to develop standards that will address this. So, coming together is a beginning, keeping together is progress, working together is truly success. For others, it's writing a check, be it $10 or $10,000, whatever the case may be. And so getting involved means different things to different people. And so what we want to do is to create something that will allow people to get involved in a way that is meaningful to them. And so this was a vision of Mike Kirby's, that to create, dare I say, a social movement that is akin to Walk for the Cure. Everybody knows that is dealing with breast cancer. What we've seen happen in HIV/AIDS, why can it not happen for mental health? So the Commission, again, in its role as catalyst, is going to try to create that momentum, and I encourage and invite each and every one of you and your families, friends, everywhere to get involved when you hear about Partners for Mental Health in the upcoming months.